Hi, yeah, welcome back to my channel. So guys, wonderful to have you guys back again. It has been a wonderful weekend and holidays, and if you're first time of watching my channel, please, I want you to subscribe, like, share. Guys, share, like and subscribe so that YouTube is going to recommend my video to more audience, to more viewers. Okay, so guys, it has been a wonderful holidays, and you can looking like a doctor. Well, I'm not a doctor, okay? I'm a nurse. So I'm going to be sharing you guys more of insight related to my professional careers course. I mean, I'm a CNA student, and this is here life in Dubai, okay? The safest academy, one of the best institution in CAN. We want to talk about CNA, where actually means certified nurse assistant or caregiver. Okay, so guys, I will share you guys more like related to this professional class. Okay, in aspect of betting. Okay, question has been shown to me. A question has been asked to me by a viewers, and that is blessing from, I think this blessing from Cameroon, and she's asking me what is the meaning of betting. Okay, so guys, I will answering this question within a short period of time. What is meaning of betting? You know, in caregiver course, in caregiver terms, we have what is called betting, and there are two categories of bets. Okay, betting background. There are two types of bets: the traditional basic use with soap and water, and disposable bait, which is pre-packed in single-use unit and heated before use. Also, okay, guys. Now, what is meaning of a bet? A bet. Bet means betting a patient who is confirmed to be bed and who does not have physical and mental capability of self betting. Okay, guys, self betting. These patients who needs bed in bed are those who are in plaster cast and traction on restrict bed rest, parasite unconsciousness, and those who have undergone surgery. Okay, that is the meaning of what bedbetting. Okay, so in CNA, in caregiver course, a bedbetting is actually take place within a patient who is sick, okay, who is unconsciousness. This is where you applied all those technical skills, okay, towards that patient. So, and I'm going to show you guys the video, okay. You know, Safe Fast Academic here in UAE Dubai has every materials, has every techniques, okay. You know, they equip the students so that when you go out there in a clinic, in any private facilities, you can able to practice what you have been taught. So that is why in this video, guys, I'm going to show you guys this video how a patient is being what bet. Okay, so I want you to stick. Let's go.
Of course, to remove this one,
The pillow.
the pillow. Okay, we have to remove the pillow. Okay, and then once we remove the pillow, we will put the uh, the basin into the head. We will put the basin into the head for us to rinse properly. Okay, but before putting it, we have to make sure that we put towel also. Okay, so we will put towel on the head area of the patient. Okay, okay, thank you. Of course, we have to be careful in putting up in order for the spinal or the backbone to be protected. Okay?
Yes.
And just to think that this is the basin for the head, okay, make sure that it is being done like this.
This is like this.
But it's not the basin.
Ah, okay.
The basin that we
Yes,
are
I know.
referring will be an inflated one. An inflated one to be supported. It's an inflated one, and then it will be like this. It will be like this, but inflated
For the neck. Yeah.
for the neck. So that when he lies down, this one is supported.
Okay.
The important thing here is to catch the water coming from the hair. Okay, coming from the hair. Okay? Then after that, so you will get the shampoo and everything. We will just get a shampoo and
So, something. Can you eat somebody here?
Let me see.
okay. Once you already so you have put shampoo. Okay, shampoo, and then, for example, we put shampoo on it, and then when we are drying it, you get another water, and then pour it, and then when we are shampooing, we have to massage, massage, okay, and make sure that he will be comfortable.
Yes.
As I've said, when he is conscious, ask what type of shampoo he is using. Why? Because when you are inside the facility or when you are inside the hospital, there are several shampoos, conditioners, lotions available in there. If he has the dedicated shampoo, conditioner, lotions, then you have to have it. And then get all those things. Once it's done, you can pat dry the hair by means of using this. Okay, that towel. Okay, that towel. And then throw the water that is being used. Then done. You are already done with the hair. Okay, it's very easy to do that one because we are also washing hairs, especially the hair of a lady. We have to make sure that we will do it gently, especially in rubbing the scalp. Clear? And then next is the face. Okay, next is the face. Make sure that this one is always here, especially when it's not yet being wet. Okay, especially when, but do not use this one in cleaning the face because you will use several of this. Maybe you will use 5 of this or 6 of this or 7 of this. It depends. Okay? Now, in this area, in this time, you will be using a basin with water. Okay? Where's the other basin? Saan may isang basin? Basin with... here. Okay? Now, we will be using this one. Okay, now let's start in the face. In the face, okay, make sure that we have, we already have this one, towel. This one. Where are we will just use this one as our table. Okay. Okay. Now, there will be 2 basins. Okay? There will be 2 basins. Basin with water, and then basin will put soap on it. Okay? So, basin with water, clear water, and then basin with soap. The basin with soap is the one that we will be using for cleaning, and then basin with this one for rinsing. Okay? Now, let's start. For example, I put the water here, and then this one with soap. Okay? Now, let's start with the face. As I told you a while ago, there are two ways on how to do it. Using the mitt or using the folding. Okay? It's up to you. Now, I will be using the folding at the moment. Okay? Folding. Okay? Now, the first thing that I will do is, of course, to rinse the face of the patient. Rinse the patient. In here, we have to start the eyes area. In the eyes area, it should be from inner going out. But tell the patient to close the eyes. Okay? To close the eyes. In here, of course, you don't need to put soap, only water. Okay? Or else, it will be, yeah, okay? Have you tried putting? Okay. So, what you will do, this one, okay? Close. Okay? And then, put it going out. Okay? Okay, ma'am or sir? Okay, sir. Let me start wiping your eyes. Going out. And then, clean it up. Going out. And then the other side. Okay? Going out. And then clean it up. Going out. So the eyes is okay. Clear? Clear. And then, after the eyes, the face. After the eyes, we will consider the face. Now, we use letter Z. Letter Z of like this, and letter Z opposite. Okay, letter Z and letter Z opposite. Okay, how to do the letter Z opposite? And okay, now we will be using several of this. Okay. First is I will wash. Okay, and then one, two, then three. Okay? Clear? Okay, again. 1, 2, then 3. And then clean this area. Okay? Then clean this area. You put water on it. Clean water on it. Now we will use soap. So clean this one. Clean this one. We already used this one. Clean it with soap. Okay? And then this one.
So this one was without.
In this one, you already throw it. That's the reason why you will be needing a lot of this.
Okay, you throw it, don't wash it out.
No, throw it in the, this will be considered as a laundry already. Laundry. Okay? This is not disposable. Okay? Now, we finish it, we will use soap. And using the soap, again, same. 1, 2, 3. And then if you already have 4. With soap. Some are doing this. They're putting soap 1, 2, 3, and then 4. And then what they will do, they will soak it here, the one with soap. And then they will do same as what I did. Letter Z. And then the other one, letter Z. Okay? Clear? Now, what if I will using the mitt? If I will be using the mitt, I will do it like this. Okay? Again. 1, 2, 3. Okay? So I use this, and I use this. Okay? And then here. Clear? Clear. You can use this, all of this. So that, and then after that, same as true when you are putting soap. 1, 2, 3, 4, 5. Okay? Clear. Clear. Clear with the face. And then after that, you get a clean towel for pat drying. For pat drying, you can just only do like this. Pat drying. And then throw. And then we're done with the face.
By the time you finish to the leg, I think it's only 2 hours.
Sorry?
By the time you finish the whole body,
Because we are discussing. But if you will be alone, then you have to finish it only maybe 15 minutes.
Can it? Because it's,
Yeah.
They're not doing
That's the procedure in the hospital.
I think
Unless,
it takes
so,
long.
yeah.
You're doing this one every day?
Yeah. And
Yeah, it
for
will be
many
every day.
patients,
Everything. It will be
you can
everything.
have like maybe 15 to
Yeah.
20 patients.
And it's not only you. It will be a lot of you.
Teamwork, yeah.
Yeah,
That's
teamwork.
the good thing.
Nursing assistants,
Yeah.
caregivers,
Teamwork, yeah.
Sorry?
caregivers, jobs.
Whenever it's in the facility, it will be caregiver's job. Whenever you are in the hospital, it will be our CNA job. Doctor will not do this.
No.
Nurses will not do this.
No time.
Nursing assistant will do it.
It's our job.
Clear?
Yes.
That's why I told you before.
But in India, nurse also do.
Sorry?
Even in my country, nurses are doing this.
Yeah, nurse.
Nurse are doing it
Yes.
because they're cost cutting.
They
Do
want
you
to
have
go
nursing
and
assistant?
hire the assistants.
No, because in our place, even a CNA, if you are like CNA, they will teach you the things normally the nurse are doing. So if there is any place you are going and the nurse, they not have like, they have a problem, there is not enough nurse, at least you can do the job.
Yeah, but
It depends of the place.
yeah, but the thing is, mostly these things are being done by nursing
Yeah,
assistant.
exactly. Yeah.
Yeah, nursing assistant. Okay, if it is not nursing assistant, then the nurse will be doing a lot.
It's too much.
It's too much. Okay? Okay, next. We're done with this. Okay, what will be the next after the face? The neck. Okay? In the neck, we can only use one. Okay? By means of doing this area. Okay? I'm sorry. And then there. Then, okay. Okay, clear? And then up, of course, you have to do the back. But in the back, make sure that you are what? He is protected. That's why we will do the back later. Later when you do the side. Okay, when you do the side, because it's not possible for you to do like this. Okay, maybe he will get what? The back get damaged. Okay, is that clear? Now that we're done, with this area, we can now put the pillow back. Can you give me the pillow, the white one, that one? We can now put the pillow back by means of 1, 2, 3. Remove this one first, and then 1, 2, 3. Put the pillow back.
So I have a question.
Okay,
If
but
the
this is
person-
not the pillow. Huh? We have pillow.
If the person is
Okay, and then throw this one into the laundry basket.
I have a question.
Yes.
If the person is very heavy, right?
Yes.
Heavy, you cannot do it.
Heavy.
Yeah.
You have to have at least 2 or 3 nursing assistants with you.
Okay.
Okay, the hospital will be considerate for that matter.
Okay.
Okay, when he is heavy. Now, the next one is the arms. Okay, the arms. As it stated a while ago, make sure that you have to open only that side.
Which you're going to do.
Okay, make sure that it's open that side. But let's pretend that we remove the. Okay, for the body. Okay.
That is a good word to the world.
Okay. Now, let's start with the arms. In doing the arms, it will be the same thing. Let's just pretend that we have a, what do you call this one? A table here, okay?
Okay.
There will be table here, or there will be table here. But because Save Us is cost cutting, we don't have table, okay? There. Okay? Then, the first, from cleanest to dirtiest again. We say from cleanest to dirtiest, arms, and then this one, and then armpit. Okay?
Yeah.
Arm, 1, 2, 3, and then 4, and then this one, and then armpit. Okay, let's do it one by one. Now, the first thing that we will be doing is to rinse, of course, can you remove this one? There. Okay, is to rinse water. Okay? Sorry because this one, because Save Us is costing. I took all the towels at home. And my wife is asking, what's the towel? Yeah.
Not acceptable.
No. I bought this one. Okay. So same thing as I've said a while ago. There are two things again. Either we will use the meat or this one. Okay. But in international examination, they are using this. Okay. I am just telling you this because it is also being used internationally. Okay. Now let's do it. The first thing that you will do is to, of course, rinse. Okay? Rinse, but putting 1 will be here, 2 will be here in this side, 1 will be here, 1 will be here, here, and then here. Okay? Okay? So when he is doing like this, 1 will be here, 1 will be here, 1 will be here, then 1 will be here, then 1 will be here. Okay? Now it's rinsed, throw it into the laundry basket, and you get another one for soap. As I've said, in doing the soap, either you already have the soap here, or you put soap on it. Okay? All. And then put water on it, and then again, putting soap 1, 2, 3, and then 4. Throw it, and then get another one for rinsing. For rinsing, 1, 2, 3, 4. Once it is done, we'll go with this. In here, you will do spa. If you want a spa by means of massage. Okay? Doing massage, there's no need for you to do like this. Put water, then do like this, then do a little of massage, and then put rinse water. I forgot to tell you a while ago that make sure that when you are doing this, same as what we did in our head, you have to put towel in here. You have to put towel in here.
Always.
Always put towel on here because this is being used for pat drying. Okay?
So different
Sorry,
towels for different.
Oh, yes, of course, it will be different. So that another thing that I forgot to tell you a while ago, the water. Make sure that the water is being tested and warmed. Okay? Another thing that we need to consider, this was not discussed yet, is to check the temperature of the person, of the patient. Maybe the patient have high temperature, then it will not good. But we need to seek the advice of the doctor or the nurse if we will proceed with the bath or the cleaning. Clear? Okay, clear. Now we're done with everything. Let's go to the armpit. And the armpit, all we need to do is to just do like this. And then put soap on it. Soap, and then and then lastly, rinse again, and then clean. Clear? So this is the arms. Okay? And then after that, you will go to the body. Go to the body. Okay? In the body, you can do like this, or you can do like this. Okay? In the body. Considering that we already finished the other side.
Yeah.
Okay? In the body. And in the body, it will be the same. Okay? In the body, you have to make sure to wipe the entire part of it. Okay? Okay? There is no what's this? Motion or what do you call this, pattern for it. But the pattern that we usually do is to this, 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 and then this. And then throw it, put the soap, put soap on it, or put soap. Okay, 1, 2. If lady, we have to be gentle here, especially when it has big one. Okay, put, then this one, then this one, and then the side, and then the side. And then, once soap is done, again, rinse it.
Yeah.
Okay, and then after that, because we don't have this one, we will pat dry with the new one. Pat dry. Once we're done with it, can you close the railing? Can you close the railing? Close the railing. Okay. Once we're done with it, we will go to the back side. In the back side, make sure, this is already finished, make sure that he is safe by putting up the railings. Okay? And then, as I've said, as stated last time, when we are putting up, make sure that we are what? Putting it this way, okay, okay, and then 1, plus this one, okay, 1, 2, 3, and there. In putting this one, make sure that same that we are doing. Okay, with the towel, we have to put the towel here, there, okay, and then